Okay, as we did already, we went through the process of downloading the app, process of doing the whole process of running the app. So now we're gonna actually go into running the app. And to run the app, you have to go to scan the QR code on the system. So this is from the AI app online. So we scan the QR code. As you can see, it will take about 5 to 6 seconds to upload. Now you see it upload the app on our phone. So this is the front page of our app with the title. We see home page, title, myocardial infarction CDS application, and on the bottom you could see there's a button to start the application. So now a patient will present himself to a clinic or to a hospital, or even a patient could be using that app to see whenever they have some complication in the heart. So first one, you have to enter the app. You click to begin. So
let's begin.
So now as a patient, you have pain. You have a heart pain. So the first process will tell you, we could listen it to the audio and we will see.
Does the patient have a typical or atypical anginal pattern, pain, radiation, or diaphoresis, or cardiac risk factors?
So now, based on the project that we have, this is the first wording of anybody that present with heart, some type of heart pain. They go through the process. So you could read it as a patient or as a clinician who will do that. So now as you could see, there's two options. You could either say, if the patient feels those factors, you say yes. And then as soon as you say yes, it will bring you to a next level 3, which if you want to listen to the question.
Is the ECG normal or near normal?
So now the clinician will know what type of test they did, and whatever they did, was it normal or was it not normal. Same thing again. If you think it was normal,
measure troponin level 6 to 72 hours after the onset of chest pain.
So they will give you a next directive to do on level 4 when they did that. So
are troponin levels normal?
So same directive also. So as a clinician, you will get that question. So with the information that you have in hand, if you say yes,
consider outpatient evaluation for patients with low cardiac risk, perform stress ECG. For patients with moderate risk or abnormal ECG, perform stress test with perfusion scan.
So
for patients with high risk, perform angiography.
So this was the directive for somebody with high level of troponin. The clinician also, if in the other case it doesn't have that high level, you say no.
Evaluate as an inpatient.
So they will tell you to evaluate that patient as an inpatient. So as you could see on our app, we do have to go back to the lower level, or we could go home. So if we go back, because in each place we did say yes or no, we go back to level 2 where we had the patient in the beginning. Does he have a typical or typical pattern? If we did say no on this one, it would take us to another level, which is level 5, and there's a question that show up, and we're gonna
is there clinical suspicion for pulmonary embolism?
That question will come up again with the clinician or the patient, the nursing that taking care of the patient. If you say yes,
calculate Wells score. See table 4.
So that's another directive. They tell you if the patient comes up with that suspicion. And same way, if it's no, it will take you to a different level, which is level 6, and there's another question that comes up.
Does the patient have fever, egophony, or dullness to percussion?
So you have that comes up. So as a clinician also, you
calculate Wells score. See table 4.
So that's another, they give you another directive if you say yes. If you say no,
has the patient had spontaneous fright, anxiety, palpitation, dyspnea, or faintness in the past 6 months?
So that's our last level we get to, because this is where the requirement was. Then again, you could go back to the previous level. We go to level I think level 5. Level 4 you say
evaluate
no.
as an inpatient.
That's another level. I think level 2, to show you all the level we went to. So level 2, you say no, brings you to level 5. Level 5, we didn't say no. If you say no in level 5, you give you to the fever level, but you say yes.
Calculate Wells score. See table 4.
So that's another That's another directive the whole app will tell you. So in each level you get, in each question you get, you could either answer yes or you answer no, and will take you to another level where either you could take inpatient or you could either have a set of procedure that you have to follow. So if you want, when you finish with the whole process, the best thing, you could go always press home, you go home, or even if you think there's a question you didn't answer right or you need more, you could always go home and restart the whole process. And then also I wanted to go over a couple of challenges we did find trying to download the software and run the simulator on our computer. So that, and so also you have to make sure you try Windows or iOS system, because none of them was available to open the simulator. So that's why we had to use the phone version instead of using the simulator on our computer. So we also noticed the wording of the